after pregnancy, we have a lot of sun damage, and our skin tone is different to Jeff and Gonzague. They are much fairer. It's harder for them to get the same pigmentation that we can get. Okay. So basically, this slide is to talk about how the pigmentation come about. I think Mark is the expert, so I don't want to waste my time. I think you can do a much better explanation in Korean than I can do with this. So basically, tyrosinase create dopaquinone, and then comes the melanin. The melanin then also there's through this whole process, the dark melanin can appear through peroxidase. Okay? So tyrosinase and peroxidase are the two enzymes that are the key that create the melanin, or the color of the pigmentation. Difference between rebound and recurrence. Okay. So cysteamine is the key ingredient. So in 1966, Dr. Chabin actually injected the molecule cysteamine into the black goldfish and realized the significant skin depigmentation. So why since in the 60s cysteamine exists, but there was never a cream? We didn't bring the product here, but cysteamine is smelled really bad. So here is to explain how it actually exists in our human cell. It's actually from cysteine. Sorry, it's not. I don't know why it's so blurry. Cysteine mixed with a B5 in the process, cysteamine come across. Why I want to tell you about this, because it's inside the human cell. This is very blurry. I'll send you a better version. Next slide.
You're going to give us this
Yeah, I will send it to you.
Then you don't have to write it down.
You don't have to write it down, it's okay. This is good to know, but mainly it's the next, it's most important. What does cysteamine exist? Cysteamine, like HA filler, it exists in our body, pre-existence in all animals. So if we look at it, it exists in all the animals, and what has the highest yield is human milk. Okay, so if you look at cow's milk, it's only 124 milligram per liter. In human milk, we have 2,345 milligram per liter. The rest is all in the liver function that has the highest cysteamine existence. How we can prove this, not only by the paper. In fact, in Singapore, when I present this to a doctor, he brought down his baby who was 11 months old. The mother, since the day she produced milk, she started to wash baby face. So the baby's face and the body was two different tones. Yes. So the face was very fair, where the body was normal color. So from there, we actually have a living proof to say human milk really has that effect on our skin.
Sure.
Okay, so back in the 2000s, so earlier, before 2000, people want to stop using hydroquinone. So in the year 2000, a study has shown that start to interest into cysteamine again. So in this particular study, they have shown that cysteamine can show 80% melanin synthesis reduction in this particular study in year 2000. So this is the mechanism of action, how our product Cyspera works. Okay, so it inhibits two enzymes. So just now I mentioned tyrosinase and also peroxidase. Right. So in this part, you can see when we inhibit the tyrosinase, when you inhibit tyrosinase, therefore the dopa and dopaquinone will then be quenched. So then the melanin does not appear. However, also then later on there is the peroxidase. So this is a tyrosinase, and then that is the peroxidase. Then when you inhibit the peroxidase, the color doesn't come out. So therefore you inhibit. So instead of melanin, it then is your melanin. Okay? So
this slide here, we see the coenzyme A. One of the elements that is produced through the coenzyme A degradation cycle, it's cysteine, is degraded into cysteamine, which is then degraded through the coenzyme A as well in glutathione. Glutathione is produced outside here. It's not written in this pathway, but there is other studies that shows that. And when we see here, there is multiple level of actions. So the number one, cysteamine work in the melanocytes by reducing the melanosome activity as was described in the molecular pathways. So we reduce tyrosinase, so tyrosine to dopaquinone, and peroxidase, that's the pheromelanin pathway. It will increase the cysteine level and glutathione level, and glutathione is going to bypass from this dark melanin into the light melanin. The more you add cysteine and glutathione, the more you will get light melanin.
Switzerland, he then conduct using histamine cream, our product, to put onto the melasma patients, and he published this paper in AAD, which you are very, is a very important. And then in 2015 and 2018, we have 2 more publications done, double-blind, randomized, vehicle-controlled clinical studies. One was published in British Journal of Dermatology, JD, and also Journal of Dermatological Treatment, JD.
더블 블라인드 테스트에 관한 시스테라 테스트하고 시스팅이라고
We showed that. Oh, sorry, I forgot. So we showed that the melanin index reduction. Sorry, I forgot to change the number. So in this particular study, you can see from week 0 to week 8, there's already show a very good reduction, and then by week 16, they actually drop the melanin index reduction. This should be 67% melanin index reduction in the study.
전체 얼굴 다 하는 게 아니라.
So then the next is our Macy score. So our Macy score is actually on the patch of the skin instead of one melanin, one pigment. So in the Macy score, you can also see a significant reduction. Most of the time, if anything work more than 30%, it's already good. But this one, we actually work on a much bigger percentage of melanin index reduction. So Macy score reduction, so people actually see the patch that has actually reduced a lot.
The same study.
It's the same study, but different measurements. So in the study also that we have done, the study that actually did was to ask investigator and patient on their feedback, on their own assessment. So as you can see, investigator actually shown that histamine, there's 100% improvement from moderate to significant. So as you know, for patients' viewpoint, there's patient, we are always criticizing about ourselves. That's why they feel there was 10%. But in fact, you look at this, 90% actually see their own improvement. 10% think they didn't see anything. However, most importantly is what other people sees you. So the investigator, in fact, is 100%, patient-wise is 90%.
That provide 100% reduction. This product only provides 68% measured reduction, 58% visible reduction, only, and yet this is the best into the market. The other strongest, there is no other product that provides so good results, and this is after 16 weeks. And this product, you can use it for the long term. All the other products you need to stop. We did comparisons of different studies. And you maybe know skin cuticle discoloration defense only improved by 38%. So this is doing twice better than skin coloration defense. Hydroquinone, maybe I will show afterwards the pigment formula.
So this is another study that is going to be published. It's finished, complete. So this is the first one that is Cyspera histamine versus Cleveland's formula, which is the 3-in-1 hydroquinone based product. Okay. So this is a comparison of 25 patients and versus 25 between histamine and Cleveland's formula. Okay. Evaluation score, we use Macy score and also investigator global assessment, which is the one you saw just now in the patient questionnaire. Okay, so the age is 20 to 50 years old, and they have been have the symptom of melasma more than 6 months, and also they have not received any medication at all. So we try to keep the patient's condition as pure as possible. Okay.
So
in this, the materials Mike has explained, the histamine, the Cleveland's moisturizing cream, and the sunscreen. It was involved in this study. So what is the whole idea about this study? Because I mean, hydroquinone is big maybe not in Korea and Japan, but it's very big in the world. So what we want to show is the efficacy of histamine versus Cleveland, the hydroquinone, retinol, and betamethasone. So you can see from the beginning to the end, in fact, histamine actually showed a 7.5% superior Macy reduction compared to the pigment. Even though the number might be small, but that is significant. What we want to do is we don't want to be much more inferior, we want to be at least the same. But in fact, in this study actually show that we are even slightly better. Okay, so also one thing with Clement's formula is often we will worry about side effects, right? Side effects such as erythema, dryness, itching, and burning. So histamine can also possibly have that. But if we look at this, you can see Clement's formula, the irritation is 84%. In reverse, histamine is no irritation, is 72%, meaning there was no side effect. None of them showed this, the 72%, where the other one is the irritation. Okay, and here we want to talk about is the patient resistant to Clement's formula. So often there are percentage of patients who does not react to hydroquinone, hence they are called patient resistant to hydroquinone, hydroquinone resistant patient. So this particular case series was published in JCD at December 2018. It's very recent. It was last year, this particular case. If we look at this patient, she was on the Clement's formula for 3 years. Normally nobody put it that long because you can have very undesirable effect. For her, she did not stop because she needed that steroid to calm down her skin. The moment she stopped, she get all the redness coming out of her face. So by using even this for 3 years, you can see the pigment on the nose, the cheek, the condition just not very nice with the Clement's formula. So after discontinuing with the hydroquinone, she started with Cyspera Cyspera product for 4 months, which is 16 weeks. You can see the nose area is much improved. The face as well is much improved. It's not like that anymore. The pigment on the forehead here as well. The whole face has light. And remember we were talking about safety, right? Safety is very important. For hydroquinone, you cannot prolong use. Normally you should stop after 6 months. There's a break, a holiday vacation from hydroquinone, then you start again. However, with histamine cream, Cyspera, you don't have to stop. So for the patient, after the intensive phase, then she continued with maintenance phase, which is twice weekly. Continues since then until now, it's 5+ years. She continued to use. You can see there's the face just getting fairer, even tone, no irritation, and it's safe because there's no outbreak of anything on the face.
Normally, how long it starts?
How soon you can see? So for my experience in Singapore and Taiwan, it varies from 3 days to 14 days. You can start to see something.
So that's initial results induced by antioxidation. And the melanocyte activity takes longer. So we recommend 16 weeks treatment to get the optimal results, 12 to 16 weeks.
So to be safe, normally I would say 14 days, but today I'm sharing with you. So 3 days was the quickest I ever heard is by Dr. Coleman. So generally we will say from 14 days you should be seeing something, some form of vitamin. So this is a case we have done in Taiwan. So this is a typical melasma patient. As you can see, she has melasma. So melasma is 2-patch even on both sides. So you can see this pigmentation on her face. This is after 7 days. I don't know how clear you can see on my laptop, it's quite obvious. You can see already certain lightening of her pigment. But if apart from pigment, our product is putting full face from here to here, right? So you can see on the forehead part is lightened as well. Then you can see after 1 month it's much lighter versus the before.
And this is typical of Asian patients. Typically, you've got different type of pigmentation. Melasma is the most common one. We know it's the most difficult. Latin type of patient most often. Asian type of patient, you've got complex facial dyschromia, complex melanosis. And here you can see a mix of the melasma part in combinations with the spots, which are the aging signs of dyschromia. And here, so you typically in Asian skin, you will get mix of melasma, PIH from different stress, maybe acne, maybe other type of stress of the skin, so inflammation of the skin, and as well aging sign on the skins which induce natural acceleration of the melanosis, and as well massification of the melanocytes, just like Lentigo. Lentigo is massification of melanocytes, which will then express normally, but more melanin at the same area. So here you can see that she has different type of combination of pigmentation, melasma plus acceleration of the
Cysteamine can be effective in all those different types of pigmentation.
Cysteamine is going to be effective in every type where there is acceleration of the activity of the melanocytes, which happens a lot with melasma, and this is chronic acceleration. Happens as well with PIH, post-inflammatory hyperpigmentation. Lentigo, so solar lentigo lentigenase, typically is a massification. So cysteamine reduces the accelerated melanocytes. That's normal melanosis. So it's just going to reduce a bit the normal melanosis. Cysteamine is to be applied on the full face, which we will see, so that you get an evening of the skin tone.
About mine?
So you can see from here after 2 months, after 3 months.
There is a non-toxin effect. Typically, there is facial aging has a number of concerns to it. So pigmentation is one, hyperpigmentation, just like this lady, hypopigmentation as well. So you'll have some white spots on your skin, and wrinkles, skin hydration, skin irritation maybe. And cysteamine does not address wrinkles, hydration. It will address the pigment part and the oxidation of the part, which is going to bring some glowing effect, brightening effect to the skin.
Skin tone. This is important. Skin tone, brightening.
So this is also work on the acne. A lot of us may have it. By using this, although this is a weeks, but we have cases in Singapore that's less than a week. They already see a dramatic improvement. This is a forearm hyperpigmentation. So you can see people who play golf because often they expose their arms. So you can see the pigmentation is very, very difficult to treat because it's a very big area, difficult using laser. You can see after 12 weeks, the lightening of the pigment on the forearm.
골프를 치는 사람들은 몸 전.
Also on the back, this is called macular amyloidosis hyperpigmentation. So some people, this is a skin condition, and you can see the improvement on this as well. This is a post-chemo. Sorry. I mean, for the back, there's this condition, but also in Asian, we have acne-induced PRH on the back. Many people actually have acne on the back, and hence, especially for women, we can't wear low-cut back clothes. So with this, you can actually help improve of your post-acne PRH. Then this is a post-chemo pigmentation. So when you do during the chemo, generally we will have a darker skin to our body as well. So this particular case, he's a much darker race compared to us. However, you can see the improvement on the hand. In Singapore, we do have a case. I don't have a picture, but it was a breast cancer patient who actually used Cyspera cream during the break, and it was very difficult to go through the chemotherapy and things like that as a cancer patient. But Cyspera cream was the only thing that made her happy, because whatever the pigment that she started to have after the chemo, Cyspera was able to help her to lighten. That was the only thing her son told me, that it was the only thing that the mother happy about it. Also, we can use on the lip. So many people, for this particular person, is genetic trait. So darker skin, like Indian, all that, they have this genetic defect. The lip color actually changes at a certain age, and it's very difficult to treat. After 19 days of usage, it went back to normal. So this was a patient who wrote to us to tell us how much he appreciated this, because before he found our cream, he was trying everything. But as you know, hydroquinone cannot apply on the lips. Many products claim to work and never work. Cyspera cream was the only one that worked. Personally, I've tried on my lip. Okay, it worked in 7 days. In fact, from day 1, I told them I can see, but they thought I was crazy. Day 2, day 3. So in fact, I do It's not here, it's in my phone. I am using VCR to capture my lips. In 7 days, you can see the lightening effect on the VCR. Any pigment that comes after birth, so like if you have lips like smoker lips, it's impossible. Smoker lips always has a color on their lips, so you can consider.
This here shows very interesting aspects as well. First is that you can use it on semi-mucoses.
Yeah.
You can use it in very sensitive areas.
Yeah.
So here on the lips, people are using it around the eyes as well, for lighting around the eyes on the thin skins.
이게 딱
In the intimate areas,
바지날.
yes. So we didn't do study yet, but doctors are using themselves and are reporting good cases. So we want to develop these areas in the future.
But for dark eye circle, we must emphasize is that you understand dark eye circle is not caused only by pigmentation. A lot of time that you can see dark eye circle is because of vesicular reason. Vesicular reason you cannot do it. But always on the skin, there's always pigmentation.
So 70% of the dark eye is vascular. Reporting to us, maybe you have experience.
Case studies, we are building some cases, but it's not going to be like clinical paper, but more of a
On vaginal and intimate? Okay.
What's the result?
It's good.
The case study.
or which area?
바지날.
Vaginal. So it's on the bikini line, so groin area is a good result, and also the nipple area. Shows a good
Last year's aspect of this pictures before, that there is many areas after where we can use it. The second learning here is that it works only after 19 days. On the lips, there is no hair follicles, so molecules does not penetrate.
Yeah.
Molecules need to have the hair follicles to penetrate through the skin. Here there is no hairs, and cysteamine is the only molecule that has been shown to penetrate to the lip skins.
Okay.
That means that there is an active absorption of the skin of cysteamine
Very easy.
for penetration into the cells.
Very easy.
It is active, so the skin actually, in an active form, absorbs cysteamine into the skin, into the cells, and so that makes cysteamine active.
Is it because
No.
It's because it's a biogenic molecule, it's a natural molecule, and there is, we believe, we didn't put that into evidence yet, that there are some transmembrane channels to absorb cysteamine into the cells. And that's the biocellular pathway for it to penetrate very well. We'll see afterwards how do we use it, and we'll see that it works very fast.
Here's to explain to you how to use it, because using it is the key to a proper
Using it well.
Yeah. So basically, when we say on the rested skin, meaning you cannot use immediately after washing your face. Okay. The reason why is when you wash the face, the skin becomes very clean. So when it's clean, the absorption rate will be much faster. And when you apply immediately, it will go in very fast, like Jeff has explained, right? So the absorption rate is fast. What happens? The skin will have irritation and come out much faster. So basically, we say, okay, you wait for an hour, but in Asia, we tend to have a different skin. Okay, so when you wash the skin, you have to wait. You can apply a thin layer of cream first. You have to wait for natural oil to come out. So to create a film of protection to protect our skin. That's why you cannot apply on the washed skin. However, in Europe, or basically if you have light makeup, you can actually apply on top of the light makeup. It will still work. Okay. So generally for Asia, sometimes we don't apply in the night, we can apply in the day. When you wake up, before you wash your face, you apply 15 minutes, and then you wash, and then you do makeup. So whichever, because it's not photosensitive, meaning you can apply in the day, you can apply in the night.
Very good.
Yeah. So for Asia, we tend to have makeup, and you want to remove it before you apply something else. That's just the way our mentality works in Asia. As a woman, we don't want to apply on top of makeup. So then certain doctors will suggest do it in the morning. When you wake up, you have the night cream, everything is okay. You apply because you already have a protection on your skin. Then you apply Cyspera. 15 minutes later, wash away and apply the daily. 15 minutes is good enough. Okay, a lot of people say, oh, what if I do longer? You can do longer, it's okay. Asian skin is not too bad, but how long? You don't need it longer than 15 minutes, to be honest, because it's effective.
On this point, but we have now designed this concept of short contact application just like a mask, because so that you can remove the smell. 15 minutes is enough, it works very well. Then you remove the smell. And second, you can use other cosmetic makeup attributes afterwards.
On the face, 15 minutes. If you do in other body parts, maybe, so such as elbow, you can do longer because the skin here is thicker. But the longer you leave it, it doesn't give you a better result. So why leave it? So also then we talk about can they use with other products. Because most importantly here, we don't just use Cyspera alone, right? So we talk about you can use with topical retinol, peeling agents. Here we sell between 6 to 8 weeks. You have to use those products for 6 to 8 weeks before you introduce Cyspera, because if not, the skin
well developed.
it's not well developed. And also by adding one more active ingredient into your whole regime, it can then possible irritation can happen. It's not that you can't do it together, but we recommend at least one product is used for 6 to 8 weeks when your skin already in a better condition, and then you add in another active ingredient. After peeling, how many days later?
6 to 8.
Yeah. So basically, if you have chemical peeling, so basically there's still peeling effect. Know that you don't use it.
We're not supposed to, but I mean, doctors we cannot control. Sometimes they do. They think it's going to be better.
So as long as the skin is still peeling a redness, if there are still erythema periods, don't use it, because I think it's very dependent on the skin type. I can't comment anything. I have done in the very initial stage, I used vitamin C 25%. It was okay. So it's very skin thickness, skin health of the patient.
Healthy skin, okay.
Healthy skin, to me, I think it's okay. I was having a healthy skin. So this is only on the topical, and then you have oral. So like for Accutane, oral retinol, it's fine. You can apply at the same time. It's not a contraindication. However, you need to increase moisturizing. As you know, oral retinol actually dry the skin, thinning the skin. So this is some protection is very important.
Christina is looking to use these products in Asia as well.
Yes.
So that could be an idea to expand there.
Yeah. And then for laser, microneedling, and cryotherapy, any energy devices, okay, you will only use it when erythema is completely subsided. So as you know, some laser actually does not cause erythema. It's very light that you can use immediately. We do have cases, not just one, in Singapore. They did laser, and then they apply. The patient won't listen to you, right? They apply immediately. 3 days later, come back, the whole face was outbreak. So that is to say, because it has erythema and there's damage to the skin, and when you apply, it just causes aggravation to the skin. So that is why, it's the same reason. Peeling is very deep peeling. No, don't use it. When you can see the redness, erythema, don't use it. Because we have seen complications.
Pico, in Singapore, doctor, they advertising with the Pico.
Pico laser, yes, but generally they will always tell patients 7 days downtime. 7 days you don't use. Because before, you don't have to stop. You can use until the day you receive laser. Afterwards, 5 to 7 days.